Now where the antitoxin going to come from? They are coming from equine, which is horse. So basically those are anti-equine, which means horse, anti-equine toxin. Now where they go from? Once you have a Clostridium botulism, you have to report it to CDC. Southern part is in Atlanta. Then they will give a notice to Atlanta Airport. The airport is going to ship in the anti-equine toxin to the hospital. They're going to use it immediately. Okay, that's what they do. Plus, you do some of the antibiotics. But I tell you one thing, for Clostridium, sometimes you using antibiotics, you cause another problem. We'll talk real quick. So this is Clostridium botulism. Botulism, infant botulism, wound botulism, and the food botulism. So these are the things we want to mention. It's very important. Now, Clostridium tetanus, I want to mention this really, how we say it, a little bit easy. Why? I will be drawing, take this off, and drawing right here. Clostridium tetanus. And you need to know number one. This one, you should not be worried in the United States. All the global nation of global. Remember this? The vaccine? Diphtheria we mentioned. Bacterial pertussis were mentioned for whooping cough. I left what I said I'm talking about. What is the tetanus? So we do have a vaccine can protect them, especially for the kids, because kids goes everywhere. If they have cuts on the hands, touch the decayed metal material or touch soil, very easy going to have tetanus. Therefore, we had a vaccine for them. Now we know this needs to have a booster. 2 months, 4 months, 6 months, 12-year-old, 2-year-old, you need to have a shots. Okay? Okay, what happens really for the tetanus? Coming from cuts, wounds. What are going to be the symptoms? Lock jaw. Completely muscle contraction. Look at that. You can breathe, completely muscle contraction. Now why? Which one? To control the muscle relaxing. A neurotransmitter is glycine or glycine. This toxin, tetanus, will block in glycine. So therefore what happens? This muscle will always highly contracted. And you prevent your breath. Okay, so this is very easy. Botulism block acetylchloride and the tetanus block glycine. One block relaxing, one block contraction. That's why one becomes weak, relaxing muscle. Another one is highly contracted. Now for this one, you don't have much thing to do. The major thing is you do prevention. If you really happens, go to the hospital, people give you antibiotics or antitoxin. You're going to do it as soon as possible. If you're too late, no way to do it. Okay? You can see right there. Antitoxin therapy treatment with antibiotics. The toughness, muscle toughness. Now remember, we had the DTaP vaccine. If you are confusing, this slide tells you clearly what's the mechanism behind that. Okay, muscle contracted. You have acetylchloride for muscle contraction. If it's blocked by botulism, the muscle will be relaxing. Oh, of course, the muscle have an MO. Then the glycine responsible for relaxing. If it's tetanus toxin blocks it, the muscle is always highly contracted, which means difficult to breathe. Okay, so this picture shows you very simple, clearly the story behind the botulism and the tetanus toxins, the mechanism. Next one, we want to mention another major stuff is Clostridium Perfringens. So I want to take it out because we want to talk about the different cell later on is much more, in little bit more in detail. So we're going to talk about the Perfringens first. This is Clostridium Perfringens. Clostridium Perfringens, very typical characteristics. Let me see whether I have a red color. May not have it right now. Okay, pink one. This bacteria, if you use streak plating or blood agar, it is double beta hemolytic zone. Very important characteristics. Blood agar you will see double transparent zone. This pathogen will cause a very typical symptom right there. Gas, gangrene. Okay? What is gas gangrene? Same thing, we go back. Let's say this is a muscle. This is a muscle. If you have a cuts, this area, low oxygen. The bacteria start to grow right there. This bacteria not only grow there. In this low oxygen area, they do something similar to fermentation. I will not say it's 100% fermentation, similar to fermentation. What are the results of fermentation? Is acid and the gas. These acid, together with the enzyme, could separate this muscle. So what happened? This muscle will be separated. So later on, you're going to cut these different pieces. Okay, let's say right here. And how about between these muscles once they separate? They will generate a tremendous amount of gas. Once the gas coming, what's going to happen? Underneath the muscle, what is that? Bloodstream. This is the same thing we're going to draw again. This is bloodstream. Once you have all these gas accumulated there, going to give a pressure. Okay, so this bloodstream goes to, let's say kidney, let's say liver, will not be enough. So lower blood pressure. We call it a hypertension. Not enough blood going to the organ or tissue will cause septic coma or shock. What gonna be your skin surface looks like? Looks like the picture. Very dark, no blood in there, no blood there. Because the bacteria generating in those spores, they have the specific enzymes. They are kind of like fermentation, have gas, acid. The gas like give the pressure. So separate the muscle and not enough blood in there, not enough blood supply there. So it looks like it's dark. Separate them. And then not enough go to the kidney or liver. They start to decay all those. A dysfunction. Okay, Clostridium Perfringens. They could be prevented. Most of the time coming from meat dish. Especially a low temperature, long time cooking. Remember I tell you a story. It happens in the University of Louisville. A professor who is on Sunday preparing a hot pot and go hiking with the wife, the dogs, and the kids. And the hot pot, you call it beef stew, tomato, potato, all those things. If you do low temperature, like 50 to 55 degrees Celsius, and a long time cooking, maybe 8 hours, you kill all the vegetative cells. That's a bacteria dominant. Let's say in those spore bacteria, such as Clostridium Perfringens dominant. Okay, so what we should do. In the public health, for the safety area, we talk about a temperature zone. A temperature zone, we call it dangerous temperature zone. What are they? 40 to 140 degrees Fahrenheit. You should avoid. Which means if you have to cold storage, make sure less than 40 degrees Fahrenheit. This is a kind of 3.5 degrees Celsius. Because you below that, cycrophiles will significantly inhibit the growth, like Listeria monocytogenes. This guy, if you want cooking, the setup temperature higher than 140 degrees Fahrenheit. Kind of like 65 degrees Celsius probably. If you want to do a mess. Okay, so avoid that. But standards we are using Fahrenheit is 40 to 140 degrees Fahrenheit is a dangerous temperature zone. Where you prepare foods, you have to avoid it. This is a major thing to protect yourself and to control Clostridium Perfringens. Okay? Last thing, but not least, Clostridium difficile. We will mention this. This happened in the hospital a lot, and more and more research are going on, even right now in the food microbiology area. They call it an emergent pathogen. So we want to talk about that one. Clostridium difficile. You could say the acronym is CDIF. CDIF. Okay, CDIF. First of all, this is a nosocomial infection or nosocomial contamination, which is hospital acquired, but not for carelessness, not like MRSA, methicillin resistant staphylococcus. This is the one is intensively using antibiotics. So we say it is antibiotic associated associated colitis. Now what happened? A good example is a 16 to 70 years old grandma hospitalized using amoxicillin about 7 days. Then what happened? She has water, bloody diarrhea. Together with pseudo-membrane colitis. Why? Some people in the hospital, if they use amoxicillin or use antibiotics or others, very intensively for 7 days or 5 to 7 days, the normal bacteria in the intestine will be completely killed, not only inhibited, because the bactericidal will be killed. Then the Clostridium difficile started to dominate. Once they started to dominate, they cause a pseudomembrane colitis, which is an infection. What it looks like? If you open the colon area, you will see this colon area. You have all kinds of those dots there, spots. Those are bleeding. And you will see like a membrane there. This is kind of like a membrane. So pseudomembrane we call it. What type of reason caused by this? This is the AB toxin. Called pseudomembrane colitis. Remember, inflammation domain, A toxin. And toxin domain, B toxin. So it's very easy. If you want to diagnose a person has pseudomembrane colitis caused by Clostridium difficile, what you should do? Of course, at the end of the day, you have to cultivation, isolation, identify Clostridium difficile. But it's anaerobic bacteria, difficult to grow sometimes. Take the stool sample and testing the AB toxin. Once you have an AB toxin, then you identify that this guy has Clostridium difficile. Okay? That's very, very simple. Now, we also want to mention how we're going to do the treatment. What you should do when the person has the disease. Number one, use alternative antibiotics. Seems like very ironic, but lots of people do it because Clostridium difficile has to be killed. So you have amoxicillin using there. Let's say we don't use amoxicillin. We use vancomycin as an alternative. Number two, if it's a very light symptoms, drink yogurt. Or some dairy products. Because in the yogurt, there is a huge amount of lactic acid bacteria. So what's the idea to do this? You intensively using amoxicillin or antibiotics for 7 days. So normal bacteria in the intestinal is completely killed. We need to put them back. So we let them drink yogurt to supply them with lactic acid bacteria, which is a beneficial bacteria for our intestinal area. So the idea is to put some normal bacteria back. Okay, if some people have a severe symptoms, what are you going to do? Fecal transplant. This sounds horrible, which means if people have a severe Clostridium difficile, you're going to get the whole human fecal sample from a normal people, then translocate it to the body. It sounds like horrible. Then you get like poop from the other person, go to your body. But this gives you a quick way to put the normal bacteria back to your body, to inhibit or cure Clostridium difficile. Okay? Now, Clostridium difficile, long time ago, they are always talk about the hospitalized disease. Recently, they have to, because they are related to the fecal sample. When the fecal sample goes to the field, they will be contaminated with food products. So in the food microbiology, food safety area, we call CDIF is an emerging foodborne pathogen. There's some research going right now to talk about those contamination, prevention, inhibition in the food products, about CDIF. A long time ago, people think it's only in hospital. So just want to let you know, CDIF is a new emerging pathogen for food safety. And you can see right here, this is a typical picture for pseudomembrane clitoris. And then you're going to see, you have to put the normal bacteria back, and or maybe use another antibiotics. So the common antibiotics, so amoxicillin, ampicillin, clostridium. Okay. Now these slides, I would love to go briefly. I would not go too detailed, because this is another class which is food microbiology. All these bacteria are foodborne pathogen, which is a food infection. Some of them we already mentioned, some of them we're going to go over later when the examination for when we talk about applied microbiology to talk about food safety. So we just very briefly here. First of all, you should know, these Salmonella typhimurium, Salmonella typhi, the spelling is wrong. Because it's a subspecies name. They should not be elatic. Okay, they shouldn't be. When we talk about the Salmonella, we talk about the Salmonella typhimurium, Newport. Those we are talking about is Salmonella typhi. Why? When you see here, see the Salmonella typhi for typhoid fever. This is related to a horrible story for Mary Mello, so Typhi Mary. If you heard about it, you can go to search real quick. This is to talk about a lady back in 1920s to 1930s in New York City. The lady who is doing a bookkeeper, doing a cook, he has a mild flu-like symptoms and she never died. But the people surrounded her caused severe disease or died. Then the NYPD put her into the custody, like quarantine right now. For many, many years, people doing a lot of research find the magic stuff is that in her spleen there is a macrophage. The macrophage is hiding Salmonella typhi. That's the reason why she never have a big problem, but the other people will be transferred. And that is verified in 2003 by Stanford University. Very, very late. She died probably like 1960 or something. So you can search online, Typhi Mary. That's talk about is Salmonella typhi. It's a more severe human-to-human transmitted pathogen, like COVID-19, something like that. But it's a bacteria. Salmonella, when we talk about typhimurium, Newport, Thompson, when you heard about the news, recently there's outbreaks, those are Salmonella non-typhi. So I will say much less risk. But I tell you one thing, Salmonella and this guy, Campylobacter, is a major pathogen in poultry meats. In the United States, there is a regulation for the poultry meats. Salmonella has to be less than 7.5%. Campylobacter have to be less than 10.4%. But I tell you, those are not zero tolerance on poultry meats. Therefore, the poultry products, we have to roughly cook them. Cook to the internal temperature 74 degrees Celsius. No question about it. Okay? So this is just briefly. We'll mention about Salmonella, Campylobacter much more detail. Vibrochloria, we will mention in the next couple of slides. That is caused by dehydration. Severely lose water in your body. So when you do the treatment, we have to do rehydration first with antibiotics. Shigella. Shigella will generate Shigella toxin. Cause hemorrhagic uremic syndrome. Blood kidney with water diarrhea. Shigella in the United States most of the time happens in daycare for the kids. The kids go there and go poop or go potty and they touch everywhere. So the Shigella is transferred. Now E. coli, this one, we want to mention something to you, but we want to talk later on. This is a little bit complicated, not really that easy. When we talk about the E. coli, I mentioned this in the exam 1 slide very earlier. We were talking about some normal E. coli called the generic E. coli. We were talking about E. coli 9037, that's one used for fermentation, is a beneficial E. coli. We also talk about urinary tract infection E. coli. And we also going to talk about foodborne pathogen E. coli. Then that becomes more complicated. We have EHEC, heterohemorrhagic E. coli. We have EPEC, pathogenic E. coli, enteropathogenic E. coli. This is called enterohemorrhagic E. coli. Let's say 0157H7. EPEC is enteropathogenic